From marijuana now to opioids. Abuse of opioids is blamed for a second straight year of decreased life expectancy in the United States. Correspondent Ellison Barber looks at the numbers tonight.
This is occurring across the country. It doesn't matter, black, white, rich, poor. This epidemic does not discriminate.
3 weeks ago, in a Northern Virginia county 22 miles away from the heart of D.C., 5 people died from opioid overdoses in a single week.
The victims ranged in age from 22 to 34 years old.
It was a deadly week in Fairfax County, but only a small part of a much bigger drug problem. In 2016, the Centers for Disease Control says the life expectancy at birth was 78.6 years. That's down 0.1% from 2015. The life expectancy rate dropped last year as well. What's contributing to it is perhaps more concerning than the number itself. Officials say drugs, opioids in particular, are a significant factor. About 64,000 people died from drug overdoses in 2016, according to the CDC. That's 22% higher than the year before. And the rate of overdose deaths when it comes to synthetic opioids, fentanyl, tramadol, doubled from 2015 to 2016. Overdose deaths are categorized as unintentional injuries in the CDC's mortality report. Unintentional injuries are now the third leading cause of death, ranking higher than strokes and Alzheimer's, and only outranked by heart disease and cancer. Jamie Fabick's daughter was 17 when she overdosed on opioids.
I miss my daughter Helen every second of every day.
Her husband, Helen's father, found the teen unconscious in her bed the morning of a father-daughter dance.
He is the one who called 911, gave her mouth-to-mouth, but she was already gone. I always ask myself, how did we go from picking junior rings, college campus visits, to picking out a casket?
Jean McCauley lost 3 sons to opiate overdoses, her oldest to heroin.
With my own children, like, I could see what path they were going down, but I never thought in a million years that I would lose 3, not 1, but 3 sons.
Police officials say they try to educate anyone who will listen about the dangers of these drugs, but when it comes to the opioid epidemic, they say it's a problem that can't be solved with police alone. Doug?
Ellison Barber here in D.C. Thank you, Ellison.